Kids, this is going to be hella cool. We are going to be doing a super cool session of functional therapy to correct genuvarum, aka bow legs. This is also a great little session to help with knee discomfort. If you walk narrow, which will be causing sciatic issues, hip pain, knee pain, super important for functionality for walking and posture. So if you find yourself having random pain in your knees or ankles, plantar fasciitis, this could help. But specifically, we are going to correct knee disorders, bow-leggedness, and try to eliminate just everyday pain from the knees, hips, and lower back. All right, we need 2 booty blast bands. Now, there's 2 different kinds. One is like resistant bands, and you can make these using your resistant band. You just need to measure right above the knee and the middle of the calf and then tie it in a knot. So you want not the cloth ones, you want the ones that are like a yoga band. All right, you need 2. The first one is going to go right around middle of the thigh. Second one, middle of the calf. All right, now, if you have been working out with me over the years, I am huge into posture and gait. Super important for movement, right? Today, I am going to tell you to do something contrary to everything that I've taught you, but you're not going to do it any other time but right now. All right. We are going to break every rule in functional movement. We want to start in our duck butt position. Remember, we are still identifying as an in table. So lift up, duck butt, lock knees. Can't believe I'm telling you this. Feet forward. So this is going to cause your knees to internally rotate. Right now, it's okay. Sometimes we have to put our body in abnormal positions in order to get a specific muscle. One. We're working on one. We're going to unlock this mess. All right. Now, we're going to take a little step back, or apart rather. Keep your position. If you need help standing straight up for balance purposes, use a chair or your Pilates pole or hold on to something for balance. We are not working on balance today. We are not. So we do not want that to be our forefront. We want correction to be our forefront. All right. If you are not feeling a stretch through the inner thigh somewhere, let's take a little bit of a wider step. Get into your position. Now, if you are not feeling a stretch, do not worry, but I'm pretty sure you're going to. Check the position of your feet. Make sure your feet are facing forward and we are flat-footed. This would be better suited with your shoes off. In your shoes, you'll probably be everting, rolling on the sides of your feet. We don't want that. So we want to push the big toe into the floor, and I'm going to take a little bit of a further step out. All right. Now, pretend this is our range of motion. Check your position. We're going to hold for 5, 4, 3, 2, 1. Hands on hip. We're just going to do a little hinge. Little hinge. Keep that chest up. Little hinge. All right, let's get going. That's our warm-up. Now, only for that warm-up are your feet going to be forced forward. Let us begin by standing on the right leg. We're going to do our action with our left. We're going to do 5 repetitions, 3 movements, non-stop. Then we're going to go to the other leg. I'm going to show those to you first, and then we're going to do it together. So when I'm done showing you and telling you the directions, the rules of play, I'm going to stop, and then we're going to go through this together. You want to do this every single day. If you are now experiencing pain because of an imbalance, try to do this in the morning when you wake up and before you go to bed at night. Okay? All right. So the first thing we want to do is we are going to hold on to something. Remember, we're not balancing. The leg that we're standing on, we're going to have a little bit of a slight bend, but we still want that exaggerated duck butt, identified as your end table, monkey toe, and we want to have pressure on the heel. Now, when you disengage the left leg, do not lean. We want to be as straight up and down as possible. That's why we're holding on to something. Find a position where you get the best balance. All right. Now, the floating leg and our starting leg is going to be the left. We want hard flex, knee locked, and we're going to push out a little bit, and we're going to go slowly in and out, slowly. From here, we're going to transition to a rear. I'll show you side. Straight back. We're not having any rotation on the stabilizing hip. When you come back, we're going to be coming back at a little bit of an angle. See how small that motion is? Then we're going to go right into a knee up. Now we want to bring the knee up as high as we can without pushing the hip forward. That is why you must make sure you have an exaggerated duck butt and your monkey toe. You got to get grounded. So when we come up, we're pushing this part of the leg, the shin out, foot inflection to make a 90 degree. Now, if you're not able to come up this high without compensating, do not worry. Range of motion is not important. As you get stronger, it will get better, all right? Okay, now we're gonna go, let's break it down to 5, 5, and 5, and then we'll turn the other cheek and do 5, 5, and 5. I wanna make sure that this is easy and fast, so you'll do it at least once a day. So if you wake up in the morning and you're hella sore, your knees hurt, your back hurt, you might want to do it in the morning. At night, it's important to do it as well because you've had all day long to compensate and your body will go back to the path of least resistance. Setting your body in the right position before you go to bed means that you'll relax in the proper position and the healing process is faster. Just a little side note. All right, we're going to start. Are you ready? Assume your position. 1, 2, 3, 4, 5, rear. 1, 2, 3, 4, 5, knee up. 1, 2, do not lean. 3, 4, 5, turn the other cheek. Here we go. 1, 2, 3, 4, 5, rear. 1, 2, 3, 4, 5, knee up. 1, 2, 3, 4, 5. Now take off your bands. And we're going to go back to that beginning stretch. But we're going to start already in our straddle. Make sure that your feet are forward. You're in your duck butt position. If you had a stretch before, it should be a little less now. And let's go to our 3 hinge. 1, 2, 3. Awesome job. All right. Now, you must stick with this until you start noticing a straightening of the legs. And your knee, hip, and feet should feel a lot better as well as your lower back because now we are not putting abnormal pressure on those joints. After that takes place, and I have no idea how long that's going to be, depends on how diligent you are with this, as well as your beginning point in your occupational therapy. So, in probably a couple months, I will have the strengthening part, phase 2, for this type of correction. All right, guys, have fun with this, and if you have any questions, shoot me a message. I hope this helps alleviate your pain so you have a happy, healthy life.